Okay, Joel, can you please bend your spine from the head? Yeah, like this. Okay. So she had a whiplash when she was probably 5 or 6. You can see the neck is quite flat. The spine doesn't bend a lot, so it's very tight. All the spine, there are multiple restriction, mechanical restriction, especially here, here, on the top, and on the sacrum. Okay, so it's just a myth that the whiplash affect the neck only. Plus, please stay a little bit like that. Okay, look at the difference in the tension. Muscle, left side, right side. You can see on the top, it's completely different tension. Okay, there's a big misalignment here, but more or less it's very hard to push the spine to move it sideways. This is the whiplash. So the whiplash affects all the spine. Okay, please lie on your back. Now I'll show you what I will usually do. So she has some trouble with the leg, mainly this one. It has to be a reason why there is pain on a leg. So if I push the leg, if I push this one is a lot harder. Also, she has some trouble on the side of the leg. So if I push here and here, there is a different feeling. She suffers from a condition, is the Crohn disease, so it's a bowel chronic inflammation. If you look at the pelvis, if you try to move this side and this side, usually the Crohn disease affects more the right side of the small intestine. Let's leave the pelvis. No, just relax, relax. Way heavier on the right, very light. But you can tell there is a misalignment here, and then there is a big mechanical restriction on the middle of the thoracic. It's very hard. If I grab the lumbar spine and I try to move left to right, it's more tender than right to left. If I do it on the neck, it's the opposite. So, movement, restriction. Okay? The shoulder, this one doesn't matter. This one is a little bit harder, but basically the spine is completely twisted. When I touch the sacrum, so let's say the pelvis, and the head, her spine is moving this way. Okay? So basically, when you have an injury, she probably had a seatbelt obviously, your body continues to move as the trauma happened yesterday. So it's been probably more than 20 years that you had this accident. The seatbelt usually cross the body, and when you have the whiplash, also your body tend to twist. Okay, in fact, when she bends, her body twists a little bit, but you can tell, I mean, there is a big difference here. This side is different. If I pull the leg left and right, now the collar doesn't help, but you see the pelvis is completely twisted this way. If I pull here and if I pull here, it's a lot more hard to pull. So this part doesn't move down. Some therapists will tell you there is a shorter leg. Is never the case. Shorter leg doesn't exist unless you have a fracture. Okay? Lift a little bit here, put it down. To understand what's going on, you need to touch, you need to check, you need to find. Lift a little bit. Okay. So this is the position of the treatment basically. I can only be here because the whiplash, when I know a person had a car accident, it's 100% the whiplash, but the whiplash doesn't affect the neck only. Even if you saw the neck to be completely straight, but you can tell the pelvis, you can tell the thoracic, so the posture is completely misaligned. Regarding the Crohn disease, the bowel has innervation on the lumbar spine, has innervation on the vagus nerve that comes from the head. So anyway, my goal is to straighten the spine and make it more flexible when you bend it sideways, okay? And also when it bends forward. Deep breath. Again.
My neck's improved a bit.
The neck improved.
Yeah.
To be honest, there's been a click on the
Right.
pelvis. It also look a little bit more aligned. I know it's not 100% because there is something on the head, on the skull. You feel? I mean, it's not like before. It's definitely more flexible than before.
Yeah.
So this part moves better this way. This part moves better the other way. Okay. So the head is a little bit tilted this way. Okay. When the head is tilted that way, I check the area of the skull. So upper thoracic, you see, now this one is a little bit tender. So the neck improved, this part improved. Now this part is a little bit worse, and C2 should be, yeah, it's not great. Tell me about the head, injury, operation.
Because I had an operation on my teeth.
Okay, perfect. You feel? Less movement, a bit more movement, here less movement. So there is a compression in between the maxilla and the frontal bone. So it's a little bit, which can explain this, you feel?
Right, yeah,
this is still, so the neck is okay, the bottom, but here
Yeah, it's really hard.
the very top is very hard, okay? For this treatment, I will take another session because it's a little bit long. So I'm quite happy with this. I will pull the leg. Okay, so the leg, I don't know if you remember, but in camera it should be visible. This part moves better than before. It's more in line, okay? It's more in line the pelvis. Lift a little bit. Take a deep breath. So the spine is quite good. Now the part that became a little bit worse is this one, which is the innervation of the skull. You feel? This one doesn't move now. This one is okay. The neck itself is okay. There is just one point on the top. Okay. Take a deep breath. Okay. So next time we will do this one. It's basically a restriction on the maxilla. The head is like this. It means that it cannot be straight. So there is a restriction here that doesn't allow the relation in between the neck and the head to be a little bit more flexible. So there is a very, very big tightness here, okay? And so there is no movement. It's painful as well, yeah?
Yeah.
Yeah. Look at this. The other side is completely different, okay? On the leg, there should be, it's quite soft. It's quite soft, so there can be an improvement. But again, there is connection because everything is connected. So I expect that after that one, this part will improve. Just one thing, can you see it? Just want to have a check if anything is visible after this. Move a little bit your hair a little bit up. Yes, like that. Can you do exactly the same as before? Just bending the spine. No. Okay, good. Okay. Let me have a check. Perfect. Stay a little bit like that. Okay, there is a little bit more mobility. Okay, so the neck is different than before. There is a little bit more curve. It bends a little bit more. It's just this part now. You see, that's the innervation of the skull. Is the upper thoracic area, which doesn't bend at all. Okay, perfect. This is the next treatment for the moment. Thanks for watching.